London to Poland, every step across the ocean. The ruling classes, them is in a mess. Oh yes, the capitalist system and regrets. But the Soviet system now progress.
Welcome to the Weekly Workers' World Labour Show. I'm your host, Shirik Trubani. Thank you once again for having joined us. Now, even though media coverage around HIV and AIDS has subsided, many South Africans are still directly or indirectly affected by the disease. For thousands in the country, HIV and AIDS is either causing death, pain, suffering, or the loss of loved ones who are often the breadwinners for families. The disease is affecting the working class and the poor people the most. Workers are also affected directly at the workplace, either as being HIV positive or working with others who are. Since today is World AIDS Day and UNAIDS has Equalize as its theme for the year, our discussion today will focus on the latest developments around HIV and AIDS, the pandemic, the UNAIDS theme, as well as the targets for the Africa Centre based at the Stellenbosch University. But first, before we get into our discussion with our panelist guests in studio, let's bring you this week's insert brought to us by the Workers' World Media Productions editorial team.
The statistics regarding people that are affected by HIV and AIDS across the world, roughly it's about 38.4 million people that are living with HIV and AIDS across the world. And in sub-Saharan Africa, it's 26.5 million. And then in South Africa, 7.5 million. And out of those, the 7.5 in South Africa, 64% of those are women. And 32% are men, and then children below the ages of 14 years are constituting 4% of that population.
We as women living with HIV, we want to see more resources allocated to women organizations, women living with HIV organizations, because there's a lot of work to do, even on GBV, gender-based violence, and PMTCT, but still, women living with HIV organizations are not having funding.
What we're observing is that because of challenges such as stigma and discrimination, particularly among young people, they then do not even show up for treatment.
As I am a woman living with HIV, I know the pains of being positive. I know the challenges, and I don't want people to pass through what I passed through in the area of stigma. I have been stigmatized in the past from the family I'm coming from, but right now I've overcome stigma. I'll put stigma under my foot and I'm working on it.
Our first point is to address where the flow comes from, which is mother-to-child transmission, vertical transmission. And so in the last 2 years, we have done an enormous amount of work. First, trying to get a mapping to understand where all the women go to get delivered of their children, where they receive antenatal care. And we find that the majority of women actually do not receive care in facilities.
The epidemic has been with us for so long. In the context of South Africa, it can be traced back to about almost 40 years. So it has been a lot of work of allocating resources. And then also, people just get to a point where they get quite fatigued about it. And also other things have come up. And then the developments around treatment, that people now receive antiretroviral therapies. They also now get, a PrEP and PrEP treatment. It does show that, it can be managed. And so I think as a result, it no longer seems to be a death sentence that it seemed to be at the time that it started. And other pandemics have also arisen in any case. So the shift from HIV and AIDS was inevitable.
With the COVID, it was not only, I think, HIV AIDS, but the rest of the world, obviously, that came to a standstill. But unfortunately, even with HIV, it was one of the epidemics that was sit in the background. And people did not have access to the clinics or to medicine, and it is something that should have been there on a daily basis.
Here we are, almost 3 years later after, the emergence of COVID-19. HIV and AIDS is still around. We're saying, okay, here we are. They've had their health status compromised as a result. So the interplay between the two pandemics in there was a very unexpected and not well understood issue and context.
There's a big amount of education that needs to be done, not even with the layperson, but also with people with academic qualifications or people in the workplace. For example, here at the Africa Centre, we present 3 academic programs that we are looking at the management of HIV AIDS specifically within the workplace.
Right, so as we heard there in the insert, clearly there is still a big challenge, even though the media attention around HIV and AIDS has largely died down. Of course, we recall in the early 2000s, it was a big political potato because in this country there was a contestation about how we understood the virus and more so the treatment thereof. Of course, we've come a long way since then, but you know, the challenges still certainly remain. And we're going to have that conversation now with my panel of guests. To my left, we have Rudy de Kerk, a PhD student at the Africa Centre for HIV AIDS Management at Stellenbosch University. Thank you so very much for joining us. Renee Sparks, they're also a community activist, founder in health advocacy as well as clinical compliance. And Dr. Bert Davis is a senior lecturer at the Africa Centre for HIV and AIDS Centre Management, Stellenbosch University. Thank you so very much for having joined us, gentlemen and lady. I maybe want to start off with you, Dr. Bert. Let's do a quick refresher. What is HIV and AIDS? HIV is different from AIDS. Let's just do a quick refresher.
Yeah, so HIV is, of course, is the virus that causes HIV AIDS. And through the years, there's been a lot of confusion. Is HIV and AIDS the same thing? That's what we heard in the early 2000s. I think one of the reasons for this was the way that we wrote HIV and AIDS. You know, we would write HIV/AIDS. So is it the same thing? Is it not? But HIV is the virus, and then AIDS develops after you have HIV. So that's when you get sick, basically. That's when you're
still a virus that till today is treatable, but not necessarily that there's a cure for it.
Yeah, it is treatable and it is manageable. And what is happening these days, you said of the things that have happened in recent years, is that HIV is often seen now as a chronic manageable disease. You know, it's listed along with other diseases like like diabetes, for example. Yeah. And I think that has led to a lot of complacency around the disease in recent times.
Because we know a lot more, I suppose, about exactly what we're dealing with. Went from taking a lot of drugs to 1 or 2 tablets and you're good to go. What have we learned in the years that are passing around the disease itself? Do we understand a lot more?
Yes. We have a better understanding of HIV with the development of technology, of medicine, and there's also been the activism in HIV and AIDS, which have also assisted in the development of better policies with regard to HIV and AIDS.
Have policies like that translated to communities? Are communities understanding it better? Are they less scared of it? Is there less stigma around it? What are your thoughts, Renee?
There is less stigma, but there's still stigma. So I'm not going to say it's completely gone, but definitely we are having communities or the populations that are actually living with HIV, so people living with HIV at the forefront of programs and of policy and being part of the championing of destigmatization of.
And where there's education, before I go on a break, where there is education around it in communities, do you find that there's a higher degree of treatment and less spread of the virus compared to sub-Saharan Africa, for instance, where there's a disproportionate number of people that are struggling with the disease?
I think we still see pockets of it flaring up wherever. I mean, as we migrate through populations and communities, we see different populations and pockets flaring up all the time. So it's not to say that just because we have stabilization in one area and education was really good, we still see it in subgroups.
Is it true, Dr. Rudy, that, or Dr. Bert rather, that we sit with a disproportionate, at least picture on women and children that are more affected, and why is that the case? If so, it is sexually transmitted.
Yeah, I mean, in Africa is where we're sitting with a big problem, where our vulnerable population is young girls, adolescent girls, and young females. I mean, if you look at the statistics, it is staggering. I think something like more than 60% of females in Africa, of people becoming HIV positive in Africa, are in this vulnerable group. I mean, and of course also in South Africa. And there's a myriad of reasons for this. You know, transactional relationships with older men, females not being able to access certain reproductive services. And so on, and
I mean sexual abuse, and the list can go
yeah,
on. And I want to get into all of that
yeah.
and how we understand it. So once we return from the break, we pick up on why the trend still remains as high as it is, in spite of all the education around. All right, we talk about HIV and AIDS. It's World AIDS Day, and it's still, I want to say a phenomenon. It's a reality for very many people. We sit within sub-Saharan Africa, high numbers of infections around the world. It looks pretty much the same. Lots more education, lots of advancement in the medical science around HIV and AIDS, but it still remains a significant problem. In terms of the medical science around him, I'm not talking just the management, Rudy, about the disease itself. We're hearing about, you know, take this one pill and it's going to help. We're hearing about reducing transmission from mother to child. We're hearing about efforts to come up with a vaccine that will provide some degree of protection. There was some good science, but that dithered a little bit. In terms of the medical science around preventing and the spread of HIV and AIDS, are we making strides in that regard?
Yes, definitely. So we are seeing that there has been progress with regard to the medical side of HIV. With regard to the rollout of a vaccine that is being discussed, and we are seeing in other parts of the world where it has started. So we are seeing that there are progress in that regard.
Does you know, Dr. Burt, does the white blood T cell and the T cells and the white cells, do we know a little bit more about how they interact? And does COVID give us some sort of an insight into how, for instance, that disease affected HIV and AIDS patients, and how we can manage, for instance, what we do in building up the immune system? Is there any correlation between those two?
Yeah, I mean, we've learned a lot since the advent of COVID in terms of you know, how to go about managing HIV interventions, and I think the fact that we've had you know, a network on the ground with healthcare workers knowing how to manage an epidemic and a pandemic, you know, that gave us a lot of tools to then, when COVID came along, to actually also manage COVID. Yeah.
But do you get the sense, Renee, that you know, people are a little bit more responsible? Because a big part of the campaign has been, if so you have been diagnosed, you know, take your medication so that you can have a longer quality life. And then on the other front, it is, you know, be responsible about your sexual behavior in particular, because that is one of the big drivers of the spread of the virus. Has there been a shift in either mindset or in practice among communities?
I think we still have a lot to do. I think what's come about through medical technology and the fact that we have other drugs available to kind of also prevent infection, that's been a huge help. The testing modalities that we have allow people to test in the comfort of their own homes. So we've got many things to our disposal to kind of help with that, but I don't think that our work is done when it comes to education and kind of getting people's mindset into taking ownership and agency.
And Rudy, how fast are we diagnosing cases? You know, is there a little home test that one can use these days?
Yes, so we have seen the development of, you know, the self-testing kits. Those have been rolled out, and those have been working quite effectively. There's also then that you can go to your health facility to also have testing, and many workplaces also offers HIV testing. So there are numerous access points where you can actually test for HIV.
But are people inclined to go and do the test? Because, I mean, you know, that's always a difficult thing, because that comes with complications around my employment, and oftentimes people then are frowned upon in a work environment, even though it's your own medical you know, situation that's meant to be private and confidential. There are also all of these other complications. What is the experience in terms of the rate at which people are testing?
So we are seeing that numbers of people are actually coming through for testing, and all these tests are confidential, and that's the reason why we are seeing that people aren't that reluctant. There are some reluctancy, but in most cases people are not that reluctant to test. And in many cases we also see that where it is an outside group like an NGO or some external clinic coming through to do the testing, people are feeling more comfortable to actually come forward and test.
Yeah.
The team can perhaps help me, but I think in terms of our testing numbers in South Africa, the 95 numbers, I think we are close to that mark of 95% of people.
And of those
going for testing.
95% or so people that we're testing, what is the positive rate? Do we know?
I think the positive rate is in South Africa around 13%,
Yeah.
where it's currently at. Yeah, so it's still quite high.
Okay, and from the work that you guys do at the Africa Centre at Stellenbosch University, maybe just explain to us what does the research unit do there, and in relation to HIV and AIDS in particular.
Yeah, so this question makes me very excited,
Yeah.
because research is my passion, and we've got students doing a postgraduate diploma in HIV and AIDS management, and then we have master's students doing research, and we've had more than 600 master students doing our research over the years, and they, the impact that they've had all over the world is astounding. And it's great that we also now have a PhD program, and our very first PhD student is sitting to your left there. So,
and what does a PhD student do when it comes to taking on such a big subject matter where we know that it's treatment and not necessarily, yes, there are people that are working on that. What is the focus of your study?
So the focus of my specific research is looking at the treatment and prevention as well as adherence, but within a pharmacy setting. So the process is called PMAT, which is Pharmacy-Initiated Management of Antiretroviral Treatment, which then provides another access point for people to then have access to PrEP as well as first-line treatment.
But what does that look like? So are you wanting to understand whether if I suspect I have it, I go to a pharmacy, and what level of care then follows after I go and seek a potential test? Is that sort of the line of the research that you're trying to determine?
So the research that we are looking at is to create a framework for the PMAT process, so that this can then be rolled out or to be implemented in both the public as well as in the private sector.
And I'm wondering whether NHI and others present an opportunity for a successful program like that, because I suppose the closer we take these community interventions through healthcare, the faster we diagnose, the better we treat, and the better we manage this disease, isn't it, Renee?
Yeah, absolutely, and it creates access points for people who generally can't maybe access a clinic. I think it's a fantastic idea. So I'm a nurse practitioner, and I'm running a HIV quality assurance program in the country.
Which entails?
Which entails the quality of HIV testing in this country.
Okay.
So what does that look like? So we go to different provinces, to different clinics, and we check whether or not those who are testing according to the standards.
And are you satisfied with what you're seeing?
There's impressive outcomes, but we're looking at HIV testing or counselors for now. I'm excited to be able to start looking at nurses and at clinicians who are testing, and I'd like to see what that looks like. But yeah.
And I want to talk, once we return from the break, talk about what the attitudes are when people are then visiting these clinics in communities, etc., because that has often been a big challenge raised in previous times. So we'll come back to that as we continue our program on this World AIDS Day.
At Africa Centre for HIV and AIDS Management, we are offering a postgraduate diploma for professionals and practitioners who are already in the world of work.
We present 3 academic programs. That is firstly our postgraduate diploma. That is a 1-year program, and then students can continue with a master's program, an MPhil, and then we also started a PhD program. So the basis of our programs are to have a look at how to manage HIV and AIDS within the workplace. That is our main focus, on how to look at the impact within the workplace, how to prevent HIV AIDS, and also at the ethical issues and how to do research projects in the field, how to mobilize communities, and also having a look at the epidemiology of HIV, where it comes from, and all the impacts that it has within the community and within the workplace.
The Africa Centre for HIV and AIDS Management offers several courses. If you wish to apply for any of these, then visit our website aidscentre.sun.ac.za. Applications close December 9th.
All right, we're talking about AIDS and the pandemic that we sit with. Once, on everybody's lips for political and other social reasons, but still a big challenge that we confront with at this time. Do you believe, Dr. Burt, that we're getting somewhere in terms of the education, particularly around education? Because, of course, there was a lot of hype around COVID because the symptoms and the deaths were immediate. This is slightly a bit long-term, slightly unknown. Do you feel that the shift has happened in terms of how we understand the virus, and particularly communities in workspaces?
I'm very positive.
Yeah.
I think there's been many education programs over the years that have been very successful. But the fact of the matter is that there are still a lot of people that don't know. Recent research, I think, from the Medical Research Council showed that I think something like there's still 30-40% people not knowing, what STDs are. So those kinds of stats are shocking. And I think what that tells us is that we perhaps need to look at more tailored programs. Focusing on specific groups, specific audiences, seeing where the needs are, and then tailoring our programs, education programs for specific groups.
Yeah, and Renee, I just want to come back to the reception that those that suspect they may well be suffering. What type of reception do they get when they go to these clinics?
So I think I've also heard various comments, but I think we've got the South African National AIDS Council with the Civil Society Forum, which is made up of different sectors, and those sectors are community-based. So if anyone is experiencing victimization or stigmatization within facilities, they can report that in order to still access care. But as Rudy pointed out earlier, the NGOs are also testing. So I would urge anyone to just access a space of testing. Also, the HIV self-screening kits are available, so you can take a test and go test yourself at home if you understand what the inserts say. But yes, we are still seeing a lot of stigma and bad or poor treatment.
A lot of which really is again born out of the fear and the stigma and the what if and my job and my home and the family unit that could be compromised and so on. There are very many of those particular challenges. But do you think that maybe we should shift the conversation to say, yes, it's unfortunate you got the disease, but you can live with it and you can have a good quality life living with it? Do you think that is predominantly what ought to be the message?
Yes, definitely the message need to be that a person living with HIV and who are on treatment would be able to live a long and healthy life. And we have seen that in the research that has been done previously. And so that means that we need to start when we're counseling the person coming for testing and who then test positive to then express that message through to them.
Yeah. And talking about that message, I want to just quickly, Dr. Burt, pick up on South Africa's big fight at the World Trade Organization and elsewhere regarding accessibility to these medicines and the patents involved and how costly they are and so on. I know South Africa has made some good strides in this particular regard, but is medication readily available generally at the moment and still at a rate that is affordable to places like South Africa, Southern Africa?
Yeah, I think South Africa is doing very well in terms of antiretroviral medication, supplying medication to, I think, how many, maybe the panel can help me, how many people do we have on antiretrovirals? I think 6 million people on antiretrovirals? And, people are definitely accessing their medication. But, in saying that, there are still there are still cases. I have a student that's doing research in Swaziland, looking at adolescents accessing PrEP, for example. And we did find there that, for example, there are stockouts and there are problems, of course.
But Renee, getting people to get access to the medication is one thing, but getting them to take the medication is another. What is the level at which people are actually being disciplined about taking their medication?
So I think, we've shied away from discipline. We're trying the education route and about making it their decision. I think there's been a lot of change with the way that we use language, especially in the past. It would have been punitive. It would have been me sitting and counting the drugs as a nurse in the clinic. Now it's about a conversation and about trying to get them to understand what happens actually when you don't take it. And also having people living with HIV kind of championing that message. I think that's been really one of the best things we could have done.
Yeah, yeah. And Rudy, your sense about whether you think at the moment we are entering a dispensation, because I mean the United Nations have come up, with a very broad term to say, let's make it accessible, let's talk openly about it. Do you think that programs like these can work? And given what Renee's experience would be, what you guys are witnessing at the moment, what you're investigating in terms of your research, do you think that we can begin to talk about HIV/AIDS with less emotional baggage in future?
So with the research that we are doing, the process is a differentiated service delivery model. And so there is no one size fits all program. We need to look at each specific community and how we actually then address HIV and AIDS within that specific community. And we then need to then move forward on that, and then building into what the UNAIDS theme is of Equalize, and where we then create better access, because that links back to the NHI principle of creating access for
universal access, that is.
Yes.
Renee, I'm out of time. We're out of time, but I just quickly want to say the important message is get tested, isn't it?
Absolutely.
Yeah, and that testing you can happen at a clinic very close to you. It is accessible, drugs are accessible, and the point I think of our discussion here on World AIDS Day is to say it doesn't need to be stigmatized. You can have a good quality life if so you get tested, and if it is that you happen to be positive, that you can get the necessary treatment. Gentlemen, lady, thank you very much for coming in and joining us today.
Thank you.
Thank you very much. Right, and that brings to a close our discussion on UN World AIDS Day happening on the 1st of December. And the message stands, get tested and treated so you can have a good quality life. From all of us here, thank you very much for tuning in. Until we chat again, bye-bye.